harmony as a team transferring instruments and other such dental items. The doctor works on the right side of the patient while the assistant works on the left. Showing on the next slide is a few different ways the operatory can be set up. According to Namibia Dental Association, female dental assistants were first hired in the 19th century when lady in attendance signs were routinely seen in the windows of dental offices notifying patients that there would be a female assisting the doctor. A sample of this sign is shown on the next slide. There are many tasks an assistant must do each day to succeed in an office. Setting out everything needed for the next procedure is an important task. If items are missing from the setup, the assistant would need to get up and retrieve what is needed, causing the procedure to be delayed. When seating the patients, the assistant must address the patient by their first name, make sure all paperwork is filled out correctly, review with the patient what the procedure is to be done that day, and offer them items such as an iPod or blanket to keep them comfortable. The assistant would then take the patient's blood pressure. If the patient's blood pressure is too high or too low, the doctor may not be able to work on the patient depending on the procedure being done. Setting up the room for the doctor is also an important task. The patient should be laid back with the overhead light fixed on the teeth that are being worked on, and the doctor's chair and handpieces should be in the right positions. During the procedure, the assistant must anticipate the doctor's needs to help keep the procedure running smoothly, stay on time, and increase production. Assistants have many other duties such as taking x-rays if needed, scheduling appointments, cleaning and wiping down the room, and sterilizing all of the instruments. According to the American Dental Association, the duties of a dental assistant are among the most comprehensive and varied in the dental office, requiring both interpersonal and technical skills. Not only is there four-handed dentistry, but there is six-handed dentistry as well. Six-handed dentistry involves the doctor and two assistants, which we will see here on the next slide. This type of dentistry is not as popular as the aforementioned dentistry. In this case, the dentist and an assistant would be sitting on the left and right of the patient, while the other stands on either side or behind the patient's head, depending on the room's setup. The assistant sitting on either side of the patient would perform tasks like normal, transferring instruments back and forth with the doctor. The other assistant would take over certain duties that the doctor would normally perform, like changing burrs or grabbing the air-water syringe. This type of dentistry speeds up the process and relieves stress and tension on the doctor. Both four-handed and six-handed dentistry have improved greatly over time. An article on Internet Scientific Publications states that the use of four- or six-handed dentistry and proper ergonomic design is necessary to prevent repetitive strain injuries, which can develop over time and can lead to long-term disability. Both types of dentistry are used by all types of dental specialists, including orthodontics, who specialize in braces, periodontists, who specialize in gum disease, and endodontists, who specialize in root canals, which is shown on the last slide.